Good afternoon, everyone. Thank you for joining us today. Our session today is a masterclass for high-performance patient intake, data automation, and AI. My name is Ross Therian. I am an enterprise account executive with Lead Squared, partnered with health systems for over 20 years, helping to drive outcomes, including measuring and improving patient experience, which the intake process directly impacts. I'm thrilled to be joined by three great speakers today. And so joining us is Kent Rogers. Kent is the Vice President of Operations at Posterity Health, where he focuses on building scalable operations and analytics frameworks in healthcare. Kent brings a data-driven mindset to healthcare operations, ensuring streamlined processes and improved patient outcomes. Thank you, Kent, for joining us. Akash Shah is the Senior Director of Sales at Lead Squared, heading our healthcare vertical. Akash has extensive experience in CRM solutions across healthcare, BFSI, and other industries, and he specializes in solving intake and operational challenges for organizations. We also have David Zetter joining us. David is a practice management strategist and speaker and past president of the National Society of Certified Healthcare Business Consultants. David is on the executive board of the NSCHBC and is a certified healthcare business consultant. Thank you, David. Thank you all for joining us today. And so I think really the format for today will be a conversation, and we have some questions that we're going to ask our experts in order to gain some great insight into the intake process and how we can help shape that to provide a better patient experience. And so we will start asking questions, audience, along the way. There'll be a couple opportunities where we'll put up a poll. We'd love to get your feedback. And certainly there's a place where you can ask questions. And so we'll have a Q&A at the end of the session. So let's get started. My first question will start with you, David. Would love to have a sense of your experience around what is the biggest challenge that practices face today in terms of the intake process?
Well, the biggest challenge from my perspective is most often it's humans handling that intake, whether it's, collecting demographics, whether they collect insurance cards or not, just gathering all the information correctly tends to be a huge challenge. I mean, we do lots of revenue cycle assessments, analyzing whether the whole billing and collection, the revenue cycle process is accurate and efficient or not. We just did a revenue cycle analysis on a cardiology practice a week ago, and we found over $1 million worth of claims that were denied or rejected due to demographics and all the intake information being collected improperly. So for instance, if you have William Smith that's coming to your practice and you enter him as Bill, because that's how he introduces himself, you have issues because the insurance isn't going to know Bill Smith. It knows William Smith. So just little things like that, or transposing numbers, characters, anything like that, it becomes a massive challenge.
Thank you. Thank you. Kent, Akash, do you want to add anything to that?
Yeah, I mean, our challenge was different, right? We have that challenge too, right? Getting new patients in the door with the right information and getting it in accurately. But our challenge was really before that. So our technology forward approach to male fertility is somewhat disruptive in the industry. We're going to fertility centers and ask them to stop using, qualified providers that they've had for a long time. And so to that end, we were held to a higher standard. And so we had to be very proactive and engage with their patients and get their patients in very quickly. And so when you look at a traditional EMR and I think the way healthcare typically approaches the marketplace, it's very reactive. And so we had our own cadence where we were making, we'd receive a referral, we'd get it into the EMR, but then we were dropping stuff into Excel, making outreach phone calls, emails, texts. And with a small team and a rapidly growing business, we just couldn't keep up. And so it was really the marketing automation element of Lead Squared that was the game changer for us.
I will just say, based on my lived experience around the measurement of patient experience, the concept of friction during the pre-intake and during the intake process can have a major impact on the patient's overall experience of their perceived experience of their healthcare encounter. And so doing things to streamline the process on the front end to avoid that is oftentimes a good indicator that the way that they score the totality of the encounter will be higher.
Yeah,
Yeah, please.
So I've been talking to a bunch of customers as well as practice leaders in the healthcare space as well, and just to tie into what all of you have been saying, so I look at it through the numbers lens, right? So be it the AMA or the MGMA, or let's say across the board, a general guideline would be to have, say, two to three front office staffers for every provider. There would be about, say, 300,000 practices, outpatient and specialty, in the United States. What I'm trying to get to is the current recommended need is about 600,000 people in front office, and we would be at about 400,000 people employed. Add to it turnover rates, folks leaving the industry altogether, a 10% incremental growth in the industry. We'd be talking about a 200 to 250K of front office deficit, and I'm not even going to the provider deficit. Interestingly, a bunch of customers also told me the inquiry to appointment takes 30 to 40 days on an average. And these are prospects, so just correcting myself there. And not all of it is attributed to, necessarily the provider crunch. They say about anywhere between 30 to 40% of this delay is attributed to the, again, tying into what David said, Ken said, attributed to the delayed intake or front office process. So I think for me, and whatever I've been gathering, the biggest problem would be, this lack of, tying everything up.
Mm-hmm.
And I just wanted to, call it out.
Thank you. We've sort of touched on this, but I would like any further thoughts on sort of taking that first question and filtering it down to the challenges that, or what is the impact of those challenges on both patient experience and the overall efficiency of a practice. And as you think about that response, I am going to ask that we put up a poll. We'd love to hear from the audience in terms of challenges that we face across the board relative to that patient intake process and how that's impacting patients or the throughput within the office. So Ken, if you want to add any thoughts around that to start, and we certainly can open it up from there.
Yeah, just Akash was saying, 30 to 40 days on average from inquiry to appointment. And that just wasn't going to work for us. So our internal goal is actually 3 business days, and our commitment externally to the fertility centers and OBGYNs that send us referrals is to have the patient seen in a week. And so, for us, being able to bring the information in off of the web, off of email or fax directly into Lead Squared, launch automation, email, text, prompt our humans to make the phone calls and the outreach was all geared to engage that patient and give them the opportunity to get their appointment booked within 3 days, 3 to 7 days. And then, from there, there's intake technology, that's mobile based or mobile friendly that allows them, to get their insurance information in, any kind of records, that kind of stuff, to complete the intake process before the appointment. So it saved us time. So we're literally doing twice the revenue we were doing before Lead Squared.
Wow.
With the same staff.
That's fantastic.
Yeah, I mean, if I just add on to what Kent brought across, right? Again, read a lot of data, talk to folks in and around data. So you'll see me, talking in and around data a lot. So, about 30 to 50% practices still make patients fill up a form after they reach the clinic instead of getting it done digitally in advance. Talking about challenges, more than 60% practices don't have a provision for self-scheduling, and patients need to call in or walk in to get the intake sorted. Kent's point on getting an appointment within the first week, I think more than half of the practices today would still want you to fill a short online form as an inquiry, and they would then come back to you between 2 to 5 working days. And that's not an appointment. That's the first contact to be made. So this is what encompasses the challenges for me in terms of patient experience.
Thank you. David, do you have anything to add relative to your strategy work in business operations?
Well, I mean, we take a full look at everything that's happening. Revenue cycle starts with the contracting and the credentialing. So you also have to make sure that the staff is aware of the issues that they have. If you're looking at a software solution, it's just understanding basically, okay, where are the current pain points? Where are all the efficiencies and the issues that the pain points in the process? So, if anybody's very familiar with Lean Six Sigma, it's all about removing inefficiencies and bad processes and systems and improving everything. So if you just look where your pain points are, if you're having an issue with, your insurance card information or the number isn't being collected properly, or a name is spelled improperly, determine where your issues are, provide education and training, provide oversight, have somebody do checks on it. And you still have to do that even if you're utilizing software, because software is not infallible. It will never be infallible. So from my standpoint, you just need to put some systems and processes in place so that you're always providing some sort of oversight, doing some spot checks. That way, at least you don't have to constantly monitor it and end up having a lot more staff in order to do the little bit of work that this can be done if it's done properly and efficiently. It won't take as many people to do it.
Understood. Kash, can you speak to, we've constantly innovate in this space, but from a technology standpoint, why do you think these issues persist despite all the advancements in healthcare tools and technology?
I always hopefully wish, like there was an EHR wave about 15 years back or a little beyond, there would be an intake wave as well. But to answer your question, I would like to break it down into largely 4 buckets, and that's what we've been seeing across the board as well. And those 4 buckets would be awareness, value, legacy, and time. Speaking on each one of these, so awareness, you don't know what you don't know, right? So giving an example, I was at a large event in September last year, 2024. And my findings were patient engagement is still a buzzword for many. CRM is at times cardiac rhythm monitoring, and not necessarily patient or customer relationship management. So the education and awareness is something which needs to trickle in. The next on my list would be value. Again, since we are a decent sized global setup, we receive a whole lot of inquiries from practices wanting to digitize their intake, outreach, communications, scheduling, patient self-service. So talking from that experience, when I happen to ask providers or practices on the outcomes they would want our patient engagement platform, say, to align to be called successful, I usually hear words like delays, not seamless, manual, and like I said, I love data. I'm itching to hear things like there is a 10% efficiency that we need to bump up. We see a 30% jump in patient experience. Happier teams, happier patients. Now, all of this eventually does happen, but the point I'm trying to make is that some practices get it, are crystal clear and do take the plunge. But then we also have seen practices which sit it out and have to be made aware of the long-term derived value. So that's on the value. Third point on my list would be legacy. A lot of the practices we meet are either moving from manual to digital for the first time in terms of intake, or have had at various points and people in their journey acquired different point solutions. So, tools which do one thing and, that's about it. So what that has translated into over the 5-10 year period is they've added more point solutions and now live with a daily problem of making these tools talk to each other, make manual connections, employ special, what they call the MIS or the reporting teams to track data across these systems. So that's on the legacy bit. And the last is time, which we all know. Practices by birth have always wanted to focus on genuine care. And that's what excites them, I believe. We all know they are staff crunched. Now, when your genuine interest is to provide care and you don't have time on the other hand, how will you invest in an initiative which may consume your time and resources? And I don't want to paint a rosy picture here because I've seen this. It will consume your time and resources. The only hack is how do you zero in on something which translates your vision into a high quality process driven practice, into a consumable software. And the guidance here is to look for a very simple, easy on the eye, a vendor software that takes full ownership right from product to setup. Saves you money, time, operational bandwidth. And lastly, there is constant hand holding. The availability of that software is always there. So, to summarize, largely these 4 points: awareness, value, legacy, and time. And they need someone who gets into your process and doesn't necessarily sell a tool. So that's what my sense would be.
Spoke about the EHRs. I guess I'll direct this one to you, Kent. So EHRs obviously have played a critical role in managing patient data and as sort of that clinical source of truth. But do you have a sense in your dealings where they fall short when it comes to intake and patient engagement? Would love your feedback on that. We'll also put up a poll to gather the audience's feedback on that at the same time, please.
Sure. Yeah, just from my perspective, the traditional EHR solutions are reactive. So if I think about how they came about, right, they were built for doctors and all about the doctors being easy to use and being able to chart and being able to bill, and billing in healthcare is just amazingly complex. So they've evolved from that direction, and I feel like the patient in a lot of ways has just gotten lost. So we're seeing better patient portals getting tacked on to EMR or EHR solutions, but they just, again, they weren't good enough for us. We're attempting to disrupt the fertility or the reproductive health space. We're asking, referring providers to change who they use, and we needed to be different. And different was specialized with great care, but it was also being fast, having great communication. And so, as I was saying before, the patient inquiry, the referral to appointment time frame, this really helped us accelerate that time frame. But we're also using it. We're also using the Lead Squared application to help us connect and communicate with the referring provider and to demonstrate our speed and value as well. So getting a little bit deep into it, again, I just think the traditional EHR solutions are reactive. They haven't really evolved on the patient-facing side. You're not going to find an EHR solution that's, really going to engage the patient up front, move them from inquiry to appointment, get them from appointment book to paperwork ready, in the cycle time that certainly we needed, and I suspect other practices that want to grow quickly and compete are looking for.
Thank you. Thank you. David, welcome to share any of your thoughts around that and kind of take that a little bit further down the path, in terms of many practices that I've worked with, and, this is going back 20 years throughout the evolution of the EHR, but believe the EHR is enough. And I'm just curious why you think that assumption might exist and what's missing, and would love your feedback.
Well, first of all, I was around and dealing with all these practices when meaningful use came up and everybody had to go to EHRs, otherwise they were going to get penalized and all that kind of stuff. Yep. I mean, EHRs have come a long ways in many years. There is no perfect EHR. Flat out, that is the answer for everybody. An EHR is good, only as good as the people that are using it. And when you choose an EHR, it's got to be everybody that kicks the tires on it, the billers, the schedulers, the providers, and so on. But, to really address the question, do we think EHRs are enough? Well, first of all, no one uses their EHRs to the extent that they're built for. No one does. There is so much data in that EHR that can help a practice improve their diagnoses, improve their quality of care, improve outcomes, but very few people mine that data and actually analyze it. I mean, no different, even in an EHR, when we're doing a revenue cycle assessment, we pull all the ones and zeros out of that system, and we analyze every piece of data in order to understand whether the practice is doing things correctly. We know how many claims the demographics were incorrectly collected on. We know how many claims somebody didn't follow up on, whether they were rejections or denied, and so on. But the biggest thing that everybody needs to be aware of, which I think everybody is you got to remember how medical practices are set up. It's usually a doctor and a nurse or somebody that they knew that hangs out their shingle. And it's a mom and pop operation. Every single medical practice was formed that way. So everybody's running it like the local grocery store. And that's not how a business is run. So when you wonder why medical practices either get swallowed up by a health system or someone else, or they go out of business, it's because they're not running a business. They're running a mom and pop operation. So most people have enough trouble. And Kent, you guys seem very organized. You're strategic. You have vision on what you want to do and how you want to accomplish things. But most people, they're doing everything they can to unlock the doors in the morning and to get those doors locked again. They don't have time to analyze the data in an EHR. Most of them aren't even following up, trying to figure out, well, why are my insurance cards not being collected properly? Some people don't even know how to evaluate that. So that's where most of our issues lie, is that you have mom and pop operations. Now, in the health system and hospital-owned facilities that almost the entire country has transitioned over to in the past 10 years, which, if you recall, this happened back in the 90s too, and then they spit them back out again. This is going to constantly be cyclical. We're always going to have this where health systems are buying practices and spitting them back out, which is happening right now again. Heck, we've got 19 new practices starting up from people that were employed somewhere around the country. So we've got a lot of issues there. And I think the biggest challenge is for people to understand that you've got resources, there is technology to help you, and you have to provide oversight, and you need to be aware of what's going on so that you can improve things and improve your practice and make sure that all those inefficiencies are removed out of the systems.
Thank you. Thank you. You know, just to finish off on this topic, you know, from an anecdotal standpoint, Akash, can you point to an example maybe that you were involved with where a practice realized that they needed more than just the EHR as part of the intake process?
So without taking names, by the way, since Kent is here, I can in fact take the liberty to quote posterity. But you know, the truth is, and the thing is that across the board, the value has been similar in terms of, you know, while EHRs are great at what they do, and they've been diversifying, you know, into the realm of patient engagement with portals, communications, module, and scheduling. But I mean, there are hits and misses, and maybe mostly not all in one. But what about the pre-HR journey, right? The outreach, the inquiry, the pre-assessment, insurance, authorization, scheduling, referral management. I mean, easily put, you know, this is where most of our customers do find value. Let me give you an example. I met a practice recently which has grown from about 40 inquiries a month to 4,000 inquiries a month, and this happened in about 18 months. So pre-Lead Squared, they were managing these 40 odd inquiries with 2 front office and 1 marketing person, you know, manually, from referrals, websites, engaging with them, doing intake packets through emails, booking appointments. Things started to take a turn when the volume increased. So when they reached, say, about 200 inquiries, that meant they had to automate communications. That meant they had to integrate their engagement. You know, have a one single view of whatever has happened with the patient, be it mails, texts, you know, calls, intake packets, again, appointments, all in one place, because obviously you'll not remember everything. So that's when they started to feel the pinch, and did not want the customer experience to drop. So to add on to this, and again, I think it's similar to what Kent covered for posterity, is with this expansion, they had more referral providers, and now they had a BD team which would engage with referral providers and would want a similar tracking of, you know, engagement with the providers, just like they want the entire tracking and nurturing of the patients. So now you also want to, you know, automatically send details to the EHR after all of this, and that's where, you know, the need and value converge, I would say. So again, repeating myself, they usually need someone who gets into the process and not just a tool.
Thank you. Ken, talked a lot about the great work and efficiencies that you've developed as part of your workflows. Can you speak to the role of automations and digital tools, like how they are embedded in your process to make it smoother for both staff and patients?
Yeah, that's a broad question, but it's truly for us, it's from inquiry off the web or referral from a referring provider to the point that the couple that we're seeing tells us they're pregnant, right? And so obviously that's several months. And when there's a fertility challenge, there's several months before the actual pregnancy occurs. So anyway, so we're, again, the main value driver for us was getting the inquiry, the referrals into the system, driving the marketing automation, being able to live up to the commitment we made in terms of engaging the patient, right? Having the online intake process, having the self-scheduling, which we've added this past year, and just allowing the patient to get into it. Once they have that first appointment, they really do live in the EHR world for the most part. It was really that front end cycle that helps. We are using the technology now to manage follow-up appointments. And, we have Athena, which is a pretty robust EHR system, but we found that we could get better results, substantially better results in terms of getting follow-up appointments booked by pulling them into Lead Squared, using that automation and those touch points and the self-scheduling tools and so forth to get those people on the schedule.
That's great. Yeah, and then I'll just add a little bit of context to that, but like through the automations, we're able to create sort of this choose your own adventure journey in terms of when the touch points take place, how they take place, sort of like meeting the patient at the right time, at the right place with the right message. So I think that's fantastic to hear. And then, David, calling back to the great work that you do, if a practice wants to fix these challenges, can you at least give a high-level overview of what an ideal intake solution, process, et cetera, would look like?
Well, that's going to depend on which avenue they want to go down. I mean, if they're going to use, if they're going to use human interaction in order to gather that information, you really need to look at that entire process, follow it through, and like I said before, identify the pain points and resolve those pain points. Everything's very easily resolved if you look at what's happening, and you've got different solutions that you can come up with in order to resolve those. If you're looking at a software solution or some kind of technology, again, all I would suggest is figure out what it is you want to accomplish. So know what the endpoint is supposed to look like, and then determine whether that software, that technology is going to achieve that for you. And if it isn't going to achieve or resolve all those pain points, then you need to find other solutions that are going to resolve those pieces so that you have a fully generated process that's not going to create issues for you. And it's not easily done, because you need to be able to rely on whoever the salespeople are for that software to provide you authentic and accurate information so that you can make decisions based on the information that you're obtaining from them. But all of us realize every salesperson is only there to make a sale, and they're going to do what they need to do to make that sale. And as long as you understand that, you need to have all the questions and, look at the software, test it out, ask the additional deep diving questions that may even be pain points to the salesperson. But if you don't get answers, it's going to be very difficult resolving the challenges that you currently have in order to perfect that process so that you can run an optimal practice where you're not having those issues and you're not slowing down, whether it's scheduling a patient, whether it's billing a patient. I mean, billing, Kent said it, billing is the most horrendous process in US healthcare. It is absolutely a nightmare, and payers are screwing with that every day of the week. So how do we resolve all the other headaches so that at least we can handle the ones we don't have a lot of control over? And that's the way I look at it, trying to find every opportunity to resolve those pain points and remove that out of the entire process.
Great points. And I would say, just to zero in on having visibility and transparency around what is the success criteria so that both sides can be marching towards that same goal.
Absolutely.
So we're gonna a couple final questions, and then we'll certainly open things up to audience Q&A. Akash, just generally speaking, first steps for practices that are still relying on the manual process to start modernizing.
So again, we live in a time where everyone talks about tech, AI adoption. Which is useful. But I think the first step is to know how it is going to be useful, and I think that's what David also mentioned. The software will also need to be told and pointed in the right direction, right? So think through your ideal patient universe, your ideal patient journey, your ideal intake process. What efficiency improvement would yield what cost and margin optimization, because you're running a practice which needs to be profitable. What customer experience? What are my quick wins? Maybe identify 2 or 3 smaller tasks that can be automated within a month just to get you started. I think this is what could be the starting point.
Thank you. We're going to transition to audience questions as we do. This is open to anyone who might have some additional insight. We've touched on it along the way here, but for practice owners or leaders, healthcare leaders that are hesitant to invest in new technology, any other nuggets of guidance that we might provide outside of, clearly what we've covered thus far?
Is that to David and I?
That's to anybody.
Okay. Yeah. No, I think Akash is right and David's right. You need to know your pain points and have a good sense for where the technology can point to and address those pain points.
Yeah. From my perspective, anytime you are acquiring technology and you are considering changing processes, it's an opportunity to improve. It's an opportunity to uncover those challenges. So certainly find a partner who you can be mutually transparent with, that is willing to align to your strategic imperatives, and then of course march towards that shared success goal. Generally speaking, that is a pathway to a successful relationship, implementation, etc. So audience questions, I have a couple here. Certainly feel free to add others, all audience members, and we appreciate you joining us here. So I'm going to try to read through this, and then we'll ask for feedback across the group. So one of our audience members is part of an orthopedic office. Intake is slow. The patient checks in on the kiosk initially, and then it goes into their schedule's work queue. The patient then comes back up to the window and may give them insurance cards, driver's licenses, etc., sits back down, and then gets called up to fill out a large packet of paperwork that could take 30 minutes or more. And this is potentially a patient that's returned to this practice from 2 months ago. So it's a cumbersome project. There's more comments about the intake and backups and getting appointments through. And so just in terms of suggestions, they're trying to get, I think, the paperwork online and asking for suggestions in terms of handling what is a very intricate but also time-consuming process.
Yeah, I mean, from my perspective, right, it's creating an online experience or a mobile experience for the patient. And if you combine the marketing automation that's available in a CRM system with the intake capability, right, of a solution like this, then you can deliver the intake questionnaire, the insurance check, all that stuff to them. And you can use the marketing automation to remind them to do it on Saturday, right?
Before they
on
come
Sunday, before they come in, so that's done before they walk into the office. And it can be done, again, we're going after 25 to 44-year-old men, so you can do it on the couch in front of a basketball game versus doing it in the physician office. So the reality for us is we're 85% telehealth too. So we had to solve for not being in an office.
Yeah, the other challenge you have, Kent, is, if you're dealing with a situation as that attendee is commenting on, you're creating one heck of a terrible experience for those patients. Having to wait in a reception. Most people have waiting rooms. They don't have reception areas. That tells you something. The time of the patient means nothing. That is not a good look. The time of the patient is very important, no different than the time for the physician and every staff member in that practice. So you want to end up taking that time down. I mean, having somebody fill out a large amount of paperwork at the time they're in the office, that's a no-go. That should have been done weeks before, because now you don't even have the ability to verify insurance and eligibility of benefits. And that's going to take you time to make sure that's done correctly too. So you want to do that in advance, because if the patient doesn't have the right, they hand you the wrong insurance information, how much time do you have to follow up and get the correct information so that you can see and treat that patient? No patient wants to be sitting there while you're messing with that. So do that in advance. So when they come into the office, they're sitting in a reception area for less than 5 minutes, and then they're seen. That's how it should be. There should never be a word called waiting room in a medical practice.
Yeah, and you know, I would say it's the issues that offices feel and face from an appointment backup perspective, and you know, seeing the patient visibly upset has a compounding problem, because then the patient's filling out their CAP survey, and no matter what the level of care that was provided, they're going to have a negative perception of their time with the practice. So it is painful across multiple different areas from a business perspective.
Yes, absolutely.
So a question was asked around sort of the focus around getting an appointment within 3 days. What if you're completely booked, or maybe how did you make more time for more patients when needed? That's question 1 of 2. We'll start there.
Yeah, I mean, that is a battle, right? Is having the capacity available to absorb the patients, and having a self-scheduling application allows us to monitor that, you know, at any time, right? Because we can see how long out is that next appointment. And then we've had to hire, and then part of what we're doing is taking a unique kind of reproductive urology specialty, and we're breaking it down so that extenders, nurse practitioners, and physician assistants can take on some of that work, right? So now your first appointment may be with a nurse practitioner, not necessarily the reproductive urologist. But then you're also making the most of the time that you have with that patient. So again, a lot of our appointments, initial appointments, are done through telehealth, and you don't want the physician sitting there while the patient's finishing their intake form, right? So again, using this technology to get that stuff done, having, from our perspective, if you book more than 3 days in advance, you know, that authorization needs to be done. That intake form needs to be done. We used to collect patient responsibility up front. We're not pushing as hard on that. But again, using the technology minimizes delays in the physician schedule or the clinician schedule, and it allows you to focus that time, the clinical patient time, on a clinical conversation and not running down the paperwork or the authorization or the other things, you know, charts from the other doctor or that kind of stuff.
Sure. Any thoughts collectively on how a practice can target patients who are not tech savvy at all?
Well, in my perspective, there aren't many patients out there that aren't tech savvy. You know, I get told all the time, oh, Grandma Smith that hasn't used a computer in years. I mean, my mom's 90 years old. She uses a computer every day. I don't want to hear that people don't use computers. 99% of patients out there use computers. Somebody's just trying to shut down, you know, just create another problem or not address the situation. That's deflecting. People use computers. They are tech savvy enough. I mean, even if you're just using encrypted text or encrypted email, to, Kent was talking about scheduling patients and having enough people or enough slots on the schedule. I mean, how many people attending this presentation have no-shows on a daily basis? I mean, what are you doing to fill those? What are you doing to generate revenue for those no-shows? Again, here's another pain point. There are very easy solutions to stop it and to educate your patients, and you can end up with 0 no-shows. Or if a patient doesn't show, you can backfill that appointment in less than 30 minutes if you've got a waiting list and you have an encrypted texting system where you can notify your patients to get in the door as quickly as they want to. So, I mean, there are solutions for every problem in a medical practice. You just need to figure out what the best solution is for you and your practice, and then implement it.
I will just
please. To David's point, when we say what happens if the patients are not as tech savvy, that could also be levels of savviness, right? The point we're trying to make is even if say a patient is not savvy enough to do the entire self-service journey, to go through an intake process or fill up an intake form, they can still interact through a sophisticated system which nudges them on every step, be it through a text or a phone call, right? All of that can be bundled into one single tool as well. So does not matter in terms of, completely in agreement with what David said. And, my sense is the savviness could also be in levels. So.
Yeah, and just to take that half a step further, the way a CRM fits in with an EHR, like the EHR is meant to be that clinical record of truth. The CRM is the engagement tool where you can say, this patient prefers to be contacted by text or by email, and then you create this workflow where that patient is being communicated in the mode that they will most likely interact and respond to.
Yes.
Right. If I can add one thing, right? The technology allows the team to engage the patient better. So when they had all the pressure of sending emails and sending texts and making outreach phone calls and trying to get the insurance card number into the EMR, right? You're trying to do all that. That's a lot of stress. You take that part of it off of them, and we're able to tell the team, look, just engage the patient. So I still think we have a lot of tech-savvy patients that want that personal interaction. So we didn't take the personal interaction away. We just made it so that the person that's having the interaction is less stressed out about, all the things they have to do so that they could engage the patient.
Thank you. I will ask, like, maybe Akash, you answer this first, but in terms of when practices are adding new tools to support something like the intake process, whether it be a CRM or otherwise, how do they actually make sure that it's going to integrate with the environment and the ecosystem?
It's in the modern day, it's become fairly simpler. So let's take an example of any tool wanting to plug into an EHR. At least from our experience, what we've seen is we either have ready plugins available for a bunch of EHRs, and if there are more new ones that come our way, we look at their public APIs or explore the partnership route. As far as the feasibility is concerned. In terms of development, again, fairly simple, standard API connectivity, HL7 integration, mapping of fields, error handling. So I would say it's business as usual for us, but it's fairly simple and a standard way of doing these integrations.
Thank you. So we have one more question, audience. If you have any other questions, please do ask. Otherwise, we'll probably kind of start to wrap things up on this last one. But Kent, David, and Akash, smaller, mid-sized practices, do you have a sense for how they have and how they can successfully streamline something like intake without a large IT team or a large budget, for instance?
Yeah, it happens all the time. I mean, you don't need, you just need somebody that is going to know, first of all, the EHR. You need the vendor that's going to interface with it, make sure that they have a properly programmed interface, that it's not going, it's proven. Never be the guinea pig. In other words, you don't want to be the first practice that has, like Kent. They've got Athena. They did not want, I'm sure Kent was not the first installation for Lead Square with Athena. They already had, the programming and the setup done, the plugins done. They've worked with it. So no matter what you do, you never want to be the guinea pig. Always have whatever vendor supply you with references and ask them for all the references. Don't just let them give you just the ones that are going to give you positive attribution, because that's what a vendor is going to do. So you want to understand all the problems, and it's not about having issues when the installation's done. Let's face it, all of us on here and everybody listening, there is never going to be an implementation of a new software in any medical practice that does not have issues, because you're dealing with different setups in every situation, different hardware, different software, many different things going in together, and everything, it's going to affect everything. So you need to make sure that whoever the vendor is, how did they deal with the challenges that presented themselves during the implementation and installation? And as long as nobody was pointing fingers and leaving you sitting there in the middle, then you've got a decent vendor that's going to help you. If they start if the EHR and the vendor points fingers at each other and you're just sitting there, you need to find somebody else, because now you're going to be left there holding the bag.
Any other comments on that topic, Kanakash?
Yeah, for us, it was just depth of resources, right? You're not just buying a software product, you're buying a team of people that are going to help you achieve an outcome. And so is that partner putting the right people in front of you, or are they hiding it in a case system or some other third-party relationship or whatever?
Mm-hmm. Great. Well, we have run through our questions. I hope this was a valuable session. I appreciate everyone's time today. Certainly, as other questions come in, I'm sure they can kind of make it over to us, and we can try to get those fielded offline. But otherwise, I just want to sincerely thank everyone for their time, panelists, audience, etc. Thank you very much.
Thank you.
Thank you.
Thank you.
Have a great day.